Hi, this is Dr. Reena Rachel John once again from John's Dental Specialty Center. I hope you have seen the previous videos of ours, and if you find these videos informative, please share it with your friends and your contacts so that more people are aware of the importance of oral hygiene and dental cleaning. Thank you.
I have a missing tooth. So how do I get replaced?
So you have a missing tooth and you want it replaced. You have an option of having the tooth replaced with a removable prosthesis, that is a denture which can be put into your mouth and removed, cleaned and put it back. So that is one option, that is a removable prosthesis. The other is a fixed prosthesis. Fixed is when you have to prepare the tooth in front and behind the missing tooth and then fix it. That is called a crown and bridge. The third option is do not touch the tooth in front and behind. Only put an implant in the missing tooth area and make a crown on top of that implant. That is called an implant supported prosthesis. So you have three options. One is removable denture, fixed denture, where you are taking the support of the tooth in front and behind, and the third is the implant supported denture. I'm not talking about the different materials that are used to make the tooth. There is acrylic and porcelain, ceramic and zirconia. There are different materials. That is not needed for you to know. What you need to know is there are three types of prosthesis that you can get for a missing tooth. One is removable, the other is fixed, and the other is implant supported prosthesis. So implant supported prosthesis, you can see it here. You can see on this picture there is an implant, a screw that is put into the bone. Now when you hear screw put into the bone, you may get very scared. So what do we mean by that? It is a titanium screw which is actually very compatible with your tissues. It does not cause any reactions, right? Under local anesthesia, this is driven into your bone, which is painless, and after a healing period of 3 months, we take an impression to make the crown. That is an implant supported prosthesis, right? So you can do it for one tooth like that. For example, you can see an implant here. This was a missing tooth. You have an implant that is put here, and then you make the crown on top of that. That is an implant supported prosthesis. This is another situation where you have 3 teeth missing. So you make 2 implants and then make something like a bridge. So you have 3 teeth fixed on 2 implants. So implants are used to support the prosthesis, the teeth which are going to help you in chewing, right? That is an implant supported prosthesis. So why is implant supported process better than fixed? That's your question, right? So now I showed you here a situation where there is a missing tooth. You have an option of preparing this tooth and this tooth, that is making it small, shaping it, putting a crown on these 2 teeth and fixing this tooth. But if you have an implant supported prosthesis, you don't have to touch these good teeth. You can leave it. You can just put this implant in the bone and put the crown on top. So it's obvious, the good teeth are not touched. You are only putting an implant into the bone that is there and putting a crown on top of it. So that is why an implant supported prosthesis is better than a fixed prosthesis. Another thing is, if you do not have teeth behind, now here you have teeth behind, but in case you do not have teeth behind, okay, then you don't have tooth behind for a bridge, fixed bridge. The patient, if you want a fixed, you don't want removable. If you want fixed and you don't have a tooth behind, you don't have a tooth to prepare behind. So then that is a difficulty. You cannot put a fixed bridge. So there you can put 2 implants and put a bridge like this on top of the implant. Because if you have no teeth behind and you have to have a denture there, then the only option, if you don't have an implant supported prosthesis, the only option is removable denture. And if you put a removable denture without teeth behind, it can press on the tissues behind. It is quite uncomfortable. So that is why an implant supported prosthesis is better.
So what is the success and failures of the implant supported processes?
Yeah, that's a very good question actually. As with any treatment, you have success and failure. But as with any treatment, even for implant supported processes, you do a proper planning. So when I see you and I understand you want a prosthesis, that is you want a tooth, I have to do a planning. Whether it is a removable or a fixed or an implant supported prosthesis, I have to do a planning. If it's removable, I will take an impression, send it to the lab, they will make the denture and give me, and I will put it into your mouth and teach you how to remove it, clean it and put it. If it is a fixed prosthesis like an FPD, a bridge, crown and bridge, I will prepare the tooth, take an impression, send it to the lab, they will make the fixed prosthesis and I will cement it to your teeth. Now if it is an implant supported prosthesis, an impression alone will not do because I should know what the bone is like. So I will take a radiograph, X-ray, I will take a CBCT, that is a cone beam, like a CT scan, right? And I will take an impression to study the mold. Then I will know how much bone is available for the implant. And accordingly I will plan the implant that can be placed. That is that screw. Implant is a screw, which is done very painlessly under local anesthesia. So that is the planning that goes behind placing an implant. So I would expect the success or failure with an implant supported prosthesis to be similar to a fixed prosthesis. The only advantage of an implant supported prosthesis over fixed is, as I said earlier, I don't touch your good teeth. Secondly, secondary caries, you make that fixed bridge and you make the crown, sometimes you can have secondary decay beneath the crown, below the crown, you can have decay. That does not happen with implant supported prosthesis. But as with every other prosthesis, implant supported prosthesis also requires proper cleaning, hygiene maintenance and regular checkup with the dentist to see whether, when I say regular checkup, once in 6 months checkup with the dentist to see whether the tissues are healthy. So the implant supported prosthesis is the future. That's what we should go for. Is that clear?